Hi, Dr. Winter.
Hi, Allie.
I've been hearing a lot over the past few years about ADHD. So what is that really?
ADHD stands for Attention Deficit Hyperactivity Disorder. So what we really see are problems with inattention, hyperactivity, and impulsivity. We don't find any physical problems per se.
How can you differentiate between normal misbehavior in children and ADHD?
The child with ADHD is that 1 in 20 who is squirming in a seat or getting up out of a seat when he's expected to stay in it. Or it could even be a child who doesn't have a hyperactive component, what we used to call ADD. That's a child who actually doesn't have any problems with behavior. He or she just sort of flies under the radar. And so what happens is, unfortunately, years can go by when the child is just not performing up to their potential. Diagnosis is with a psychiatric evaluation. We get input from the parents, from teachers, from babysitters. Collateral sources are very, very useful in that evaluation as well.
So how do you treat ADHD?
Therapy is helpful for treatment. Changing the child's environment, if we can, is helpful. We work with the parents. They need to be educated, directed, supported. We work together with the teacher, the child psychiatrist, and the child. It's not a job for the child alone. And then finally, medication could be quite helpful.
What are the long-term effects of medication on the brain, if there are any?
To date, there are no known long-term side effects. There are studies that show that children with ADHD who go untreated have a higher likelihood of engaging in criminal activity in adolescence. So that association is there. It's not there for the ADHD kids who do get treatment.
So once you go on medication, does that kind of mean you're on it for life?
Treatment is a day by day, week by week, month by month thing. It's not, somebody's either on something or they're off something. We change things accordingly, and we work with the realities at the moment.
It can be reevaluated over time?
Constantly, absolutely, absolutely. What we find is, as children get older, the hyperactive component of ADHD improves substantially. The inattentive part may or may not, it depends.
It kind of seems like nowadays we're seeing many more cases of ADHD than we ever used to. Why is that?
I think that we don't really have a very good comparison because we didn't recognize ADHD then like we do today. I think people are just more aware and astute. And what's nice is that today we really have wonderful treatments for ADHD, and it can make a huge difference in a child's life. And what it comes down to is all those years in school, all those years of potential don't have to go to waste anymore.
Thank you. This puts a whole new perspective on things.
Okay, thank you, Allie.